Welcome to Ulosca channel. Access all nursing practice questions. ATI NSG 133 Mental Health Practice Questions with Answers.
Question 1. A client with schizophrenia states, "The aliens are watching me through the walls." What is the appropriate nursing response? A. That's not true. No one is watching you. B. I don't see any aliens, but it must be frightening to feel watched. C. Tell me more about these aliens. D. Let's focus on something positive. Which one is the correct answer? The correct answer is B. I don't see any aliens, but it must be frightening to feel watched. Explanation. Therapeutic communication acknowledges the client's feelings without reinforcing or denying the delusion. This promotes trust while avoiding confrontation or invalidation. Question 2. Which of the following actions demonstrates the nurse is using therapeutic communication? A. Telling the client what to do. B. Giving advice. C. Sitting silently and listening. D. Changing the subject when the client is upset. Which one is the correct answer? The correct answer is C. Sitting silently and listening. Explanation. Therapeutic communication involves listening attentively and being present. Silence can be powerful when used appropriately to allow the client space to process and speak. Question 3. A client with major depressive disorder is being discharged. Which statement shows understanding of relapse prevention? A. I'll stop my medication when I feel better. B. I should avoid talking to others about how I feel. C. I'll attend my outpatient therapy sessions regularly. D. Depression is cured once symptoms stop. Which one is the correct answer? The correct answer is C. I'll attend my outpatient therapy sessions regularly. Explanation. Long-term adherence to therapy and medication is critical in managing depression and preventing relapse. Understanding and commitment to follow-up care indicates readiness for discharge. Question 4. Which intervention is a priority for a client with suicidal ideation? A. Allow the client privacy. B. Assign a roommate for companionship. C. Remove all sharp objects and belts. D. Encourage participation in group therapy. Which one is the correct answer? The correct answer is C. Remove all sharp objects and belts. Explanation. Ensuring physical safety is always the priority in clients with suicidal ideation. Removing potential means of harm helps reduce the immediate risk. Question 5. A nurse is caring for a client with bipolar disorder in the manic phase. Which behavior is expected? A. Slowed speech and movements. B. Withdrawal from social activities. C. Excessive talking and distractibility. D. Fear of leaving their room. Which one is the correct answer? The correct answer is C. Excessive talking and distractibility. Explanation. Mania is typically characterized by rapid thoughts, pressured speech, hyperactivity, and a reduced need for sleep. Understanding these signs helps guide care and safety planning. Question 6. Which finding is a positive symptom of schizophrenia? A. Affective flattening. B. Alogia. C. Hallucinations. D. Social withdrawal. Which one is the correct answer? The correct answer is C. Hallucinations. Explanation. Positive symptoms add to the patient's experience and include hallucinations and delusions. They contrast with negative symptoms, which reflect a loss of function or emotion. Question 7. A nurse observes a client with obsessive-compulsive disorder repeatedly washing their hands. What is the best initial response? A. You must stop washing your hands so often. B. Why do you keep doing that? C. Let's talk about what you're feeling right now. D. You'll get sick if you keep washing like that. Which one is the correct answer? The correct answer is C. Let's talk about what you're feeling right now. Explanation. Redirecting the client to explore their underlying anxiety or thoughts is more effective than confronting or criticizing the behavior. Question 8. Which of the following is a priority nursing diagnosis for a client with panic disorder? A. Risk for injury. B. Impaired verbal communication. C. Ineffective coping. D. Social isolation. Which one is the correct answer? The correct answer is C. Ineffective coping. Explanation. Panic disorder often involves poor stress management. Identifying and addressing ineffective coping mechanisms allows for better long-term control of symptoms. Question 9. A client taking fluoxetine reports insomnia and agitation. What should the nurse do? A. Instruct the client to take the medication at bedtime. B. Encourage the client to double the dose. C. Recommend taking the medication in the morning. D. Stop the medication immediately. Which one is the correct answer? The correct answer is C. Recommend taking the medication in the morning. Explanation. Fluoxetine, an SSRI, can cause insomnia. Taking it earlier in the day may help reduce this side effect while maintaining therapeutic effects. Question 10. What is the priority nursing intervention for a client experiencing auditory hallucinations? A. Ignore the hallucinations. B. Tell the client the voices aren't real. C. Ask what the voices are saying. D. Encourage the client to talk to the voices. Which one is the correct answer? The correct answer is C. Ask what the voices are saying. Explanation. It's essential to assess the content of the hallucinations to determine if they are commanding or dangerous, guiding the level of intervention required.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.